Thank you, Madam Chair. It's an interesting problem you have. I was just sitting here thinking about that. If you go to CMS on one side, they say, oops, we paid you too much out of this drawer, give it back. And the end result is, oh, yeah, but you owe us more out of this other drawer. Mm-hmm. So it may, who knows, it may net positive, probably not. But
Right. If I may, let me touch on the one other issue to provide you an update on, which is the Children's Health Insurance Program, CHIP. We've been waiting on Congress to reauthorize the funding for CHIP for a while. The latest intel we have, consistently what we've been told is there's not a problem. They're going to reauthorize CHIP. It's just a matter of when they do it. Right now, it appears to be in queue behind tax reform. And so the best information is December sometime. The challenge for us is we're one of the first states that actually run out of CHIP money, and this is after there's a process in CHIP where you spend your own money, and then money that's unspent from other states gets gathered up and redistributed out to states, and all that money will be done in December. We'll have enough cash on hand to pay a portion of the capitation payments for the month of December. A route to go would be to begin 1st of December sending out notifications to parents that their children's health insurance will end on January 1st. The governor's made clear to me that we're not going to do that, that we're not going to put families through that because Congress hasn't gotten its act together yet. She's asked for us to identify some options, which I think we've got, to be able to manage our cash in such a way that that we ought to be able to maintain coverage for kids through a reasonable period of time that will allow either Congress to act, presumably, or determine that they in fact aren't going to, and allow you in February to wrestle with that problem. So we do not anticipate sending out cancellation notices or anything like that, which would be due in the next couple of weeks if we were to head down that path. One other point I should make quickly before Senator Beyer gets his question. There is a piece of this that you should know about, which is there was a population, about 40,000 kids on CHIP, who were on Medicaid before they moved on to CHIP at the higher CHIP match rate. There's a maintenance of effort requirement so that even if CHIP goes away, we have to move those kids back to Medicaid. And so there's a cost to us if there is no CHIP funding of about $2.3 million per month to cover those kids. And so there's no alternative available that doesn't result in some kind of a state financial exposure if we're in a world where CHIP doesn't get reauthorized. Again, everyone says CHIP's going to be reauthorized, so I think that's more hypothetical than real.
Senator Beyer.
Thank you, Madam Chair. So that really gets to my question. You have, given the instructions from the governor, you have enough financial flexibility to get to February?
We're examining that now, but I believe so, yeah.
Okay.
It's
Good.
a conversation that we're having regularly.
Yeah.
It's problematic. I mean, if they don't act before they go on December recess, it'd be hard for them to come back and act unless they do it retroactively before March.
Well, our expectation is whatever they do, they will do retroactive to September 30th. So again, I think
It's just a cash flow issue?
it's just a cash flow issue unless something unusual happens in Washington, which isn't as unusual.
That never happens.
With that, that's all I had for my update. I'd be happy to answer questions that you might
Are
have.
there questions or comments? Thank you so much, and we'll expect you to be back in January informational days to
Great.
give us another update. All right.
I can
Thank
just
you.
put on record, Madam Chair, that I'm delighted that Mr. Allen's been willing to do this
Just a
and is
comment.
taking on the permanent
Yes.
position, which your
Yes.
confirmation is momentarily.
Yes.
Thank you.
Senator Beyer.
Just a comment, Pat. I really appreciate your frankness. It's been your trademark through all, whatever job you've had, and it's really appreciated, and a breath of fresh air getting that out of OHA.
Thank you.
Great.